truth most women don't hear early enough: your fertility starts changing long before you actually think it does. Unfortunately, by the time most women start asking questions about their fertility, it's already started to change slowly, quietly. Understanding it early isn't always about pressure, it's about power. I always say this: in reproductive health, what you don't know can hurt you. So today, I'm breaking down what every woman should know about her fertility in her 20s and her 30s. Actually, as I was discussing this plan for this video with my sister the other day, she asked me, how could you possibly give the same advice to women in their 20s and their 30s? And she's right, so let's talk about both. Hi everyone, I'm Dr. Natalie, a sexual and reproductive health doctor, and in this video, I'm breaking down what every woman should know about her fertility. Whether you're in your 20s and just started to think about it, or you're in your 30s and wondering if you waited too long. The goal isn't to scare you, it's to give you clarity. Fertility isn't just about getting pregnant, it's about understanding your body, your hormones, and your health. And because most women don't learn this in school, they end up confused or panicking later. Knowing what changes across these 2 decades can help you plan accordingly, not just family-wise, but health-wise too. Let's start with your 20s. Your 20s are your most fertile decade. Ovulation should be regular, egg quality is high, and your chances of conceiving naturally are best here, or so studies say. But this doesn't mean that you should ignore your fertility until you want a baby. Here's what I tell women in their 20s. Know your cycle. Track ovulation and understand your fertile window. Menstruation is something you experience every month from as early as your teenage years. You really don't have an excuse to not understand how your body works. Do you get your period every month? Do you bleed 2 to 7 days? Is your period longer or shorter than that? Is your cycle length regular? Do you get your period after 23 days, then after 30 days, then after 2 months, then after 17 days? Do you get periods so painful and intense that you have to use pain medication just to get through your day? Do you bleed so heavily to the point where you're weak and tired? A lot of women experience abnormal menstrual patterns, yet they do nothing for years simply because it's common. But just because something is common doesn't mean that it's normal. A lot of the patients that I see on a day-to-day basis are dealing with situations that could have been avoided had they paid attention to their bodies and dealt with these abnormal symptoms early, instead of letting things continue like that for years. And this leads me to point number 2. Screen early for conditions like PCOS, thyroid issues, or STIs that can impact future fertility. I have an entire series on PCOS on my channel, where I shared videos explaining polycystic ovary syndrome in detail, but in a way that's simple to understand for you guys. And if you watch that series, you'll know that PCOS, if untreated, can lead to serious conditions like diabetes, heart disease, endometrial cancer, and even infertility, which is relevant for today's video. Did you know the most dangerous STIs have no symptoms? The most dangerous sexually transmitted infections, the ones that can cause you infertility, the ones that can kill you, they often have no symptoms. So people walk around not knowing their chances of conceiving have been ruined, and they don't know until it's too late. I'm not saying all of this to scare you, but to highlight just how important it is to take care of yourselves out there, and not to let society and relationships pressure you into engaging in activities that could harm you and your future fertility. And that leads me to point number 3. Do not skip your pap smears, and never skip your sexual health checks, especially when entering new relationships. Cervical cancer is one of the only treatable cancers, but only if detected early enough. This is why pap smears are so important. If you're sexually active, do get your pap smears done every 2 to 3 years, or as otherwise recommended by your doctor, as per your last result. Number 4, contraception doesn't ruin fertility, but knowing how it affects your cycle is key. There are different types of contraceptive methods: hormonal methods, barrier methods, long-lasting and reversible methods, as well as permanent methods. And the option most suitable for you depends on your goals as well as your body, because remember, contraception is not a one-size-fits-all. What works perfectly for you, for the next person, might be the worst thing they've ever experienced. I just participated in a health expo where I spent the day explaining and educating people on the different types of contraceptives available and how they work. And if this is a topic that you guys want me to get into on my channel, do let me know. Moving on, number 5, start healthy habits early. Maintain a stable weight, manage stress, avoid smoking and excessive alcohol. This one is huge, and I can't emphasize it enough. Most women underestimate just how much lifestyle choices actually affect our fertility. Your eggs don't just age with time, they're also affected by how you live. PCOS is a good example of how your own lifestyle choices can actually seriously do you harm or good. Why do I say this? With PCOS, genetics play a role in predisposing you to the condition, but women who live healthy lives and have adopted healthy habits like eating well, getting enough protein, keeping their bodies insulin sensitive, many don't have any symptoms at all. And those who weren't controlling their PCOS, when they start finally making these changes to their lifestyle habits, they actually manage to reverse their symptoms totally. Basically, your ovaries do not forget your habits. Chronic stress, poor diet, alcohol, and lack of exercise, all of these things affect your hormone balance, your egg quality, and ovulation. Every cycle is influenced by the state of your health, not just your age. Exercise is non-negotiable. Regular movement improves your blood flow to your reproductive organs, it stabilizes insulin, and it balances hormones like estrogen and progesterone. Even 30 minutes, 4 to 5 days a week makes a difference. It's not just about going to the gym, it's about consistency and moving your body. Inactive women are actually more likely to experience irregular cycles and hormonal imbalance. Alcohol hits harder than you think. Studies show that heavy or frequent drinking can actually lower your AMH, which is the hormone that reflects ovarian reserve, and can disrupt ovulation. Alcohol raises estrogen temporarily, which confuses your hormonal feedback loop. Weight also matters, but so does balance, because being significantly underweight or overweight can both suppress ovulation and delay conception. Fat tissue produces estrogen, so too much or too little of it could also throw off your cycle. You want to aim for steady, sustainable fitness, not crash diets or extremes. Where your reproductive health is concerned, always think long term, not short term. Why am I saying this? Because how you treat your body in your 20s shows up in your fertility stories in your 30s. And you can't undo a decade of poor habits overnight. Prevention is always easier than repair. And I know it's tempting to ignore this part, especially when you're young and you feel healthy and you feel like there's nothing wrong with you. But your fertility doesn't care about vibes and mimosas. It cares about your hormones, your habits, and your health. And finally, if you're in your 20s and you're in a position where you're sure having kids now is not an option, or you have a condition you need to treat now but do want children later, consider learning or exploring the option of egg freezing, because the best time to freeze your eggs is actually in your 20s and not your 30s. If egg freezing is something that you're more interested in or just wanted to know about, leave a comment egg freezing in the comment section and I'll be happy to go video on that. Now, the 30s. This is where awareness meets action. So, it is commonly known that fertility naturally declines with age, especially after 35, but that doesn't mean that pregnancy is impossible. It just means that you need to be more proactive and more intentional. Point number 1 that you need to know. Egg quantity and quality start declining gradually after 30, but more noticeably after 35. What things affect your egg quality, you might be asking? The alcohol that you were drinking non-stop in your 20s, the poor sleep, the poor diet, the lack of exercise, all these things contribute to your egg quality. The good news, while you can't change how many eggs you have, you can absolutely influence the health of the ones that do remain. How? By optimizing your nutrition, getting adequate sleep, exercising, managing stress, and cutting back on alcohol and smoking. Point number 2. Cycle changes can indicate reduced ovarian reserve. Your ovarian reserve is basically a predictor of how many eggs you have left. And when you see your cycle length start changing, like suddenly becoming longer or shorter, there could be something going on and you should definitely have it checked out. This actually brings me to point number 3. Do preconception tests and reproductive health checkups early. Don't wait till you're ready to get pregnant to start following up your hormones and everything. I encourage women to get a full health checkup done every year. Get your hormone panel done, including your AMH. Get your metabolic screen, see how well your body is responding to insulin or how badly it is. Get an ultrasound. These are all so important because, again, like I said, every day I'm tasked with helping couples navigate situations that they could have avoided had they done these health checks early. In your 30s, prioritizing your nutrition is no longer a negotiable, it is a must. Focus on antioxidant rich foods like berries, leafy greens, citrus, nuts. These kinds of foods help fight oxidative stress that damages the eggs. Include omega-3s from like salmon, chia seeds, or supplements you can use for hormone balance. Ensure that you have adequate folate, vitamin D, coenzyme 10, and inositol. These all support the egg and mitochondrial health. Number 5. Prioritize your sleep. Aim to get 7 to 8 hours of deep, consistent sleep because this supports hormone regulation, cortisol balance, as well as ovarian function. Poor sleep increases oxidative stress, which is directly linked to egg damage. Number 6, move your body. The same way that I said nutrition is no longer a negotiable in your 30s, exercise is also a must. Exercise improves blood flow to the reproductive organs and reduces insulin resistance. It also lowers inflammation, one of the biggest threats to egg health. And you don't even need a gym membership. Even brisk walking or strength training at home count. Number 7. Cut back on alcohol and smoking, even socially, because these accelerate oxidative damage and speed up the deterioration of your eggs. Give your body a clean break. Manage stress intentionally. This is such an underrated one, but chronic stress disrupts your ovulation and hormonal rhythm. Try journaling, mindfulness, or simply saying no more often. Your cortisol and your ovaries will thank you. Number 9. If you're not ready for pregnancy, but you know you want kids, consider options like freezing your embryos. Before I conclude, one important thing I need to say. If you've been trying to conceive for over a year or over 6 months if you're over 35, please see a fertility specialist or a reproductive health doctor sooner than later. You could be dealing with something that needs medical attention urgently, and delaying that could only lower or worsen your chances. In your 20s, everything seems so far-fetched, but in your 30s, reality starts to hit. The truth is, we all have different timelines. Some women have kids at 21, some at 25, others at 38, and others in their 40s. What matters is that you're well informed. And that was the point of today's video. Fertility isn't just science. It's personal, it's emotional, and sometimes, many times, it's unpredictable. So be kind to yourself as you navigate it. My key takeaway? Yes, age does play a role, but lifestyle plays a louder one. Think of it like this. Your reproductive health mirrors your habits. Every health choice that you make today improves the quality of the eggs that you ovulate in 3 months from now. If this video helped you understand your fertility better, please don't keep it to yourself. Share it with a friend. And if you want me to do a follow-up on how to boost fertility naturally, or how egg freezing really works, anything to do with women's health, let me know. And please do leave a comment and let me know which point you found interesting. When you guys engage with my videos, it helps me to understand and to know whether you found them useful or not. Make sure you subscribe so you don't miss the next one, because we're diving deeper and deeper into reproductive health and womanhood. Thank you so much for watching.